Welcome to Holographic Health Insights, the podcast where science meets soul for complete well-being. Join hosts Reverend Ann Marie Byars and her daughter Rachelle Gianaris as they explore transformative health approaches that integrate body, mind, and spirit, from energy medicine to holistic practices.
Ever feel like something's stuck or out of alignment in your chest or digestion, like me? If so, you might be dealing with more than just heartburn. In this episode, Ann Marie and Rachelle explain hiatal hernia syndrome and how it connects to emotional and physical imbalance. Welcome back, everyone. Skip Monty, co-host slash producer, back in the studio with Reverend Ann Marie Byars and Rachelle Gianaris, owners of Holographic Health, Inc. Ladies, how's it going?
Wonderful. How about you, Skip?
Doing just fine. I'm having a great day, although, as I said, I tend to have some problems with something feeling really weird in my esophageal area and actually having food get caught in there too. So I'm really interested. We touched a little bit on hiatal hernia syndrome on a past episode, so I'm really anxious to ask, what exactly is that? What is hiatal hernia syndrome and what can be done to address that?
Well, Skip, this condition is so prevalent that Dr. Baruti wrote a book called Hiatal Hernia Syndrome.
Oh, wow.
And the front of the book has a picture of what a normal stomach looks like on this end and what it's like as it tends to move up into the diaphragm and the rib cage area and get stuck and get inflamed. And when that happens, it causes all kinds of symptoms. People can deal with belching or food not digesting, or as you said, you can feel like you have a tickling in the throat, food gets stuck. And people can have the hiccups or vomiting diarrhea and not be able to swallow. My husband had a really severe case of this. And so people can feel like they're having a heart attack. They can have headaches, just all kinds of cervical or spinal pain. It really runs the gamut of symptoms in the body. And we do have ways of muscle testing for this and showing people how they can correct it themselves. It involves actually getting the stomach back down into its normal position. You learn how to do this. You can do this yourself. Or if you can't do it yourself, we have a stomach egg that is made to help you pull the stomach down. And we can teach people how to do that for themselves so that they don't hurt any of the surrounding areas or tissues. And this can be life-changing. My husband has severe issues with it, so did Dr. Baruti's daughter. And so both of them were not able to eat well, had all kinds of symptoms. He was taking a drug for this, which did not work, did not help. And so through, as Dr. Baruti always said, therapy wins. Through pulling the stomach down into its normal position, making sure not to eat foods that aggravate the stomach. And then we have a product called HHS, which is specifically for this area, that is really good for the digestion and supporting this area nutritionally. So the whole idea of working with the body at all is to get the body resynchronized, whether that's getting your spine back into alignment like it needs to be, or getting the stomach back in the position it needs to be, then supporting that nutritionally so that the body is in a homeostasis, is in alignment. It has the nutrition it needs to get well and stay well. And continuing with, as Dr. Baruti said, therapy wins.
Therapy wins. Well, exactly how does that procedure work to get your stomach back where it needs to be? Is that something you stick down your throat or?
Well, you have a xiphoid process, which is between where your ribs come together.
Mm-hmm.
There you go. Where your ribs come together, you can feel You can feel that little divot.
Uh-huh.
And you don't want to push on the ribs, but we're actually pushing under that xiphoid process and down into the left. So the stomach, we want to pull the stomach down out of the ribs and down to the left. And so you can probably kind of feel if it's sore in there. I had it once and didn't really realize it. Went into the office and Dr. Rudy said, "You have HHS." I was, "Oh, great. I've been dealing with this with other people for years and did not recognize it in myself." Now I've learned when I feel a little queasy or things just aren't digesting well, people can also have panic attacks. They can feel, because this pushes on the vagus nerve. So they can feel like they're panicky. And you get that stomach pulled down and everything's copacetic. People feel so much better. And I've had several teenagers that had nausea, had panic attacks, and instead of going and getting Prozac or something like that, parents came and we found that this was the root cause of the problem. So earlier you catch it, the sooner you can get relief. And you can see how that could set up a person for a lifetime of issues if you don't address that properly. Somebody with panic attacks, they are having to take a drug for the rest of their life because of panic attacks. Having trouble with digestion, so food's not getting in and you're not getting the right nutrition because you're not getting good digestion. And it's a vicious cycle. So the simple maneuver of getting the stomach in place can alleviate a whole host of symptoms.
Well, I'm asking this, like I said, I'm a lay person, obviously, because you stick it down your throat. And by the way, Rachelle, thank you for the demonstration with the bear. I'm sure everybody watching
You
this,
bet.
including me, was doing exactly what she was describing and what you were doing to myself, at the same time. But for instance, I was at a wedding this past Saturday and was eating chicken, and I take small bites, and it feels like it gets stuck right here, like about here. And it is so painful, and nothing will go down. And I have to jump up and down and try to get gravity to help me out. But I can't eat another bite or drink anything or even salivate. I mean, it's terrible. What is that? What that is?
Well, I think part of the issue is that once you have something anatomical like this happen, then your body wants to go right back to that spot. So it doesn't remember the appropriate position that it needs to be in. So you kind of have to help it along and get it back in that position. And you may have to do that. I think Ann said that, especially with my stepdad, her husband, that she and he had to work on this for months, maybe even a year, doing it daily to get it back into the right spot. And then eventually your muscles will remember, and the rest of your anatomy will remember where it needs to be structurally so that it doesn't happen as often. Ann was kind of describing the maneuver, and the best way to do it is like if you lean back at like a 45-degree angle, and then you can kind of get up just under your ribs. So you would start in the middle and you would kind of work it down into the left. And you can't really hurt yourself. I mean, if, obviously you could do some damage if you were pushing too hard, but usually we don't allow ourselves to push too hard into our own body. So you're just going to kind of massage it down. Some people like to use a lotion, so their skin doesn't pull, but you're really just kind of massaging it down to be in the right position. I think it is described in the book as well.
And we have instructions with our stomach egg. We have this egg-shaped piece of wood that is really designed to fit in that area and help give a little more leverage. And we have instructions with that to help people to use that to do it themselves. And, if they can't do it themselves, get a family member. I've shown many couples how to do this on each other. And that's the whole idea, is to make sure you get that stomach pulled down so that everything can flow like it needs to. The energy can flow, food can flow, everything's in the right position. And it really sounds like you do have an issue in that regard. Make sure drink plenty of water to, keep that hydrated. And there may be certain foods that your body does not like, and chicken may be one of them. So this is something we've had to work on with my husband. He loved clams, but clams did not love him, or his body did not love him. So things like that, grainy things like rice. So he's mostly vegetarian. He eats a little bit of fish, but that's all. And because it just does not work well with his body.
Well, to be fair, now I was raving about the shrimp and grits that they had at this wedding, and I took a big old bite of a shrimp, and I thought it went down, and then I ate a piece of chicken, and maybe the shrimp had something to do with it, and it's a reaction. I also have an issue where at night, if I can go to sleep sitting up, I'm good. If I lay flat, I'm horrible. I take some kind of indigestion medicine that you take every day. I can't remember the name of it. Sometimes I'll go to sleep just fine, and if I wake up and move at all, from one side to the other, get up, walk to the bathroom, and come back, this pain comes, like it's like something's shifted and it just hurts really bad. I mean, that could be the same thing.
It could be. Anytime somebody's in pain for any length of time, we suggest that they see their doctor and make sure nothing untoward is going on. But my husband's doctor recommended that he elevate the head of the bed. And so we have done that for years. And that can help things to flow better down the esophageal pathway. So that's one suggestion for anybody having digestive issues. Elevate the head of your bed and make sure you drink plenty of water. Don't eat things that aggravate this. And grainy things like grits and rice and meat that are hard to go down and digest can often be culprits.
Couscous?
Couscous is very grainy as well. So grainy things seem to be a real issue with people that have this kind of condition. Always watch and see how your body is reacting to food, whether it's an allergy or whether it's something like this. If your body doesn't like it, don't go there. Avoid it. Do something else. There's so many wonderful foods out there that we can eat. We don't need to try to eat the ones the body does not like.
Gotcha. Well,
I did want to say one more thing before we wrap up about hiatal hernia syndrome. One population that we see that struggles with this a lot are children who were born with Pitocin in their system. So if mom had Pitocin during labor and delivery, this could be a really big issue for those kiddos. So just something for moms to be aware of, or if you know as a child that your mom had Pitocin, it's just something to keep in mind.
Very good.
It causes stomach to rise up, and so those children usually have this syndrome, and it may have been plaguing them since birth.
Wow. Well, that's a lot, but thank you. I mean, you're helping me personally as well, and I'm sure there's a lot of listeners too that are in the same boat. Speaking of that, the book you mentioned, do you have those for sale?
We certainly do. Just call the office or go to holographichealth.com and we can ship one out today.
Awesome. And maybe an order of some HHS too.
For sure.
And stomachache.
And stomachache. Well, ladies, this has been great and very helpful and informative for everybody. And thank you so much. And I hope y'all have a great rest of the day.
Thank you, Skip. Have a great weekend.
All right. Talk to you soon.
Thanks for joining us on Holographic Health Insights. If you're ready to dive deeper into transformative health approaches, visit holographichealth.com or give us a call at 800-566-1522. Remember, your journey to total well-being starts here.